Hello, everyone, and welcome. I'm James Milan, and this is this week's COVID-19 update. Today, we are speaking with Christine Bongiorno, the head of our local Department of Health and Human Services. Christine, we get to see you once a month. It's never enough, so we appreciate you being here.
Thank you.
And of course, there's lots and lots to talk about, especially with recent announcements from the governor's office, et cetera. We will get to those for sure. But let's start where we always do, please, and just give us an update on the COVID status here in town, and especially your vaccination efforts that we've been hearing about over these, well, for a long time, but especially intensively over these last few weeks.
Sure. Thank you, James. It's great to be here. So as of today, we are just under 1,870 cases since the beginning of March last year. We still are seeing cases. I know that a lot of people feel like COVID is over, and that's not necessarily the case, but we are definitely still getting cases in every day. And I think, we're constantly looking at the ages, the categories, and sort of the flow of where they're getting the virus, where they're picking it up. And then with that, we're looking at our vaccination rates. So we have embarked on a major campaign to find the most sensitive in our community, so the oldest residents that could become hospitalized or even just have severe adverse outcomes if they get COVID. So we have about at this point we have about 650 residents ages 75 and over that are unvaccinated. We've been doing a number of different outreach campaigns to find these residents, and also we've been doing some outreach to people that may know these individuals. So sort of a call to action to neighbors, family, friends of anyone 75 and over that are unvaccinated. We've slowly been getting out. We've been finding and getting calls. I would say we're getting about 10 to 20 calls per week. And we're going into the homes and vaccinating people, particularly those that are unable to leave their home. Some individuals calling do want to come in for the vaccine, so we are able to accommodate that as well. Luckily now we have so much access to vaccine that we can literally offer callers any type of vaccine they want, whether they want the Pfizer, Johnson & Johnson, or Moderna. We're able to provide them the resources. We are partners with a number of communities north of Boston, and we have a clinic running each week at Tufts University. So we are able to book appointments at Tufts for residents if they want the Pfizer. Also, some of our pharmacies in town have access to vaccine as well. So we're booking appointments for people. And then we're also going into homes with Moderna and Johnson & Johnson and doing mini pop-up clinics throughout the community. So yeah, our vaccination efforts are never going to end until we're at 100%. So you'll see us out there with just our ads and our outreach, just trying to find those last individuals that we feel are susceptible of becoming pretty ill from the virus if they get it.
Yeah, and it does feel, well, first of all, let's just note, as I have with in talking to Adam Chapdelaine in recent weeks, just the whiplash effect of, we're begging and waiting for the vaccines, and okay, finally they're here, and then almost it feels on a dime where that's turned around, and now, as you said, you can choose your vaccine and choose your site, and it's just make it as easy as possible. But I wanted to say that I'm wondering if what you think. Perhaps we are, especially, well, not especially, but including among the population that you were talking about, 75 and over, and the most physically vulnerable people, perhaps. Maybe we're hitting that level of vaccine resistance. There's I imagine smaller proportion of the population here in Arlington than in many parts of many other parts of the country, but nonetheless, I imagine that there are some who are just resistant to the idea of taking the vaccine. And maybe the kinds of numbers you're talking about is just us getting close to that place where it's just hard to convince people to take it, no matter how easy and convenient and accessible you make it.
That is exactly what we're seeing. So a lot of the individuals that are calling we're spending a lot of time talking about the vaccines, the the efficacy of the vaccines, the safety of the vaccine. So we do spend a lot of time with each of the new individuals we're vaccinating, whereas before we were booking people quickly and vaccinating quickly, in order to dispense our vaccines as fast as we could. But now it's taking us much longer. There is definitely a population of individuals that have had a hard time finding the vaccine or can't get to a clinic. So we're able to get to those individuals, quickly and easily. But it's the individuals that may have lots of questions or anxious or nervous about getting the vaccine. But that's why we offer a different service than maybe going to a mass dispensing site or even a CVS or a Walgreens. We're going to be able to send our nurse and or a paramedic with an EMT, some personal service to really help people feel comfortable and to if they feel like they might have a reaction, we're there with them for the time frame after the vaccine. So we do provide I feel kind of a more a better service to our community members that may feel nervous than they could.
Yeah, it's almost as if the Board of Health is being turned into like a concierge, you know, medical providing service.
It's
It does.
we say
Sorry.
that sometimes, but to be honest, if we save hospitalizations and lives, I think we're committed to that. And I think this is the population that is at the highest risk. And to us, with our Council on Aging, because that's our biggest partner in this, and they're part of Health and Human Services. I feel like that's what we have to do as a community agency to save lives. I think that's it does feel like that at times, but these are also people that are in highest need too, that don't have family members that are urging them, or there's definitely a lot that goes into it.
Well, I just want to take a moment and again recognize for the umpteenth time what you and your staff are doing every day. What you've just described is a very labor intensive process, clearly, where you're paying lots and lots of attention to each individual you're coming across and answering all his or her questions, etc. In doing that, again, spurred by this belief that as you just said, that this is a very vulnerable population still, and that's what you care about the most, is getting people safe. So again, just an expression of our appreciation to you and your office for what you do. Speaking of perhaps making things even more labor intensive for you, even as you guys have been at this for more than a year and your energy must be flagging a little bit. Let's talk about the announcements both from the CDC last week and then Governor Baker's acceleration of the time frame for relaxing restrictions here in Massachusetts. What had been August 1st was moved up 2 full months to May 29th, just right around the corner here. And I think I probably speak for many when I say, well, that sounds like great news initially. It really does and has aspects of it, but we're also not sure what to make of it. It feels so quick. So please lend us your expertise and your experience around this, and give us some perspective on how to see these new policy changes.
Sure. So Arlington has decided to move forward and just follow exactly what the state has put forward. And, although we can appreciate that there has been a lot of science and, a lot of thought has been put into the decisions that have been made by the CDC and then the state, we also, we want to tread lightly, right? We will continue to monitor our cases and shift if things change. We continue to receive cases daily. We continue to see older people being hospitalized, which is of concern. And it's really, our vaccination rates are promising. However, not everyone in our community is vaccinated. Not everyone in our community can be vaccinated. So I think we need to continue to just monitor that and adjust if necessary. I think that the state will continue to monitor and adjust. But I do think, the conversion of our mask order to an advisory really limits our ability to make sure that masks are worn. So that will essentially, for vaccinated individuals, mask requirements will go away on May 29th, which is great, because I think it really motivates people to get vaccinated. And if the science is showing that vaccinated individuals are either not getting COVID, or if they are getting COVID, they're not spreading it and or getting sick, I think that's a benefit and a bonus for all of us that have chosen to be vaccinated. For those unvaccinated individuals that will be asked to wear masks, I just urge them to continue doing that, because if we don't continue to be vigilant, we could see ourselves back in a lockdown and or another mask order later on as time goes on. We always look at what's going on around the world. We're seeing a lot what's happening in India, but the vaccination rates are low there. We look to more to countries that have higher vaccination rates. They're still wearing masks in those countries, and it's an important difference. And so it'll just be interesting to see how this plays out. I think from a public health perspective, I do appreciate the science being used to make decisions, but continuing to watch the numbers and watch the data, and urging people to remain vigilant. And if they're in a crowded mall or a crowded area, just try to be aware, particularly an unvaccinated individual, making sure they're wearing a mask. That is crucial to keeping this virus from coming back and mutating and becoming a bigger concern down the road.
Yeah, one of the first things that struck me when I first heard about the relaxation, even as a possibility, much less as a reality, the relaxation of these conditions and protocols, was how can we possibly, it's an awful lot of trust that we're putting in our fellow our fellow residents and citizens, because we do need unvaccinated people, as you said, to wear masks. And so let us hope that is in fact how the majority of them will choose to operate. But let me ask you before we let you go, you just said still be important for people to be vigilant, and you have also made it clear that Arlington will follow the governor's guidelines. In other words, it's closest to the life before the pandemic that we've been. But let me ask you, as the representative here, our expert, and representative of our Board of Health, if you could just give your own message to all of us, separate from the guidelines, et cetera, what would you tell us that we should do, both as vaccinated and unvaccinated individuals, in a couple of different settings that we may find ourselves in quite regularly?
Sure. I mean, I think for vaccinated individuals, urge your unvaccinated friends and family members to get vaccinated. I think that's really what it comes down to. If people can't be vaccinated, which is another issue, or if they're vaccinated and still high risk because of whether it's particular illnesses that they may have, be respectful and try to give them space, and or be respectful. People have to wear masks and they're walking around. I think that's one thing, just making sure that people realize that there's still people that are vaccinated or unvaccinated that can't get the vaccine, that are still could still be at risk. So just being respectful of that. But I think it's going to be sort of a wait and see. Obviously, there are areas that we are still required to wear masks, such as transportation, healthcare facilities. So just making sure that people are, wearing masks in those locations, whether vaccinated or unvaccinated, and being respectful when asked to wear a mask, because there are really highly susceptible people in those locations. So, I think we're all eager to get out and enjoy family and friends and barbecues this summer. If people feel ill, or if they feel that they could have been exposed to someone with COVID, just get tested, whether you're vaccinated or not, and try to follow guidance from your local Board of Health, because I think we want to just prevent the spread of additional cases. It's all about those dead ends. We don't want the virus going beyond, right? So we want to make sure we're trying to limit the spread as much as possible to prevent mutations to prevent anyone that's unvaccinated from getting sick. So just continuing to be vigilant, I think, is the message of the day.
Yes, well, this has been a longer update than many of them, in fact, and it's ironic because we're getting close to, we're basically talking about signs that, we're coming out of the pandemic, obviously, very, very clear signs in a lot of ways. So you'd think it would have been simple, but it's still complicated, isn't it? Um, Thank you so much, Christine. I've been speaking with Christine Bongiorno, the head of our Department of Health and Human Services here in town, and the hardest working individual possibly in town. So this has been the COVID-19 update for this week. I am James Milan. We really appreciate, as we have said, Christine and her office's efforts and her being here as well today. We also appreciate you joining us. We'll see you next time.